Hey guys, welcome back to another video. I know I've not been shooting, but it is because that I've been busy all along. So today what I want to talk about is specialist, nursing specialist, or what can you specify if you don't want to be a general nurse. So first of all, I want to talk about the level of education that we have for nurses in Kenya. So we have the certificate nursing, we have the diploma and degree nurse, and also PhD. There are those nurses who usually do PhD in nursing, or they advance up to PhD. So guys, today I want to talk about the specialists that are available in Kenya. Some of them are not really available, but not really available in Kenya, but some of the specialists that are available that nurses can go and specialize in, or if you want to do a specific course, you can go and specify on that course. So to start with, so I was saying that, so these are the specialists, these are the field that you can go and specialize. Some of them are not provided in our country, so you can go and specialize to those countries that they offer those courses. So the first one is wound care nurse. Wound care nurse, I think it is available. There are those nurses who just specialize in wound care. The wound care nurse take care of patient with wound, either by medical procedure or injury and diseases. So these are just nurses that take care of the wound, and you can just go and do a short course on that if you want to be such kind of nurse. And then we have the veteran affair nurse. These nurses work with veterinaries to take care of them. And also we also have a urology nurse. We have a urology nurse. Of course, I'm going to confirm because these nurses, there are more than 100. So I'll just confirm and explain a bit. Urology nurse take care of patients with diseases or illness related to urinary system. So I think that one is available in Kenya, and you can go and specify on that or specialize on that. And before I continue, before I go too far, these specialists, some of them you don't have to be a general nurse so that you can go and specialize there. Some of them you can just go and they train you on that specific field, and then you become a nurse. It's not a must that you just have to go and be a general nurse. Is when you can go and specialize. Some of them you can go and just do that specific course. So the next specialist is travel nurse. This nurse work for staffing agency, take temporary nursing position in facilities across the country and global. Typically assignment length is usually about 8 weeks minimum. Yeah, travel nurse is that nurse that maybe they work with, they're usually in the airport, I think, and those maybe who have private, they want to travel in a private way, they can be given a travel nurse. So this one is, I also think that I mean, you don't have to go and do a general nurse so that you can become a specialist. You can specialize in that field. This one you can just go and do it as just a travel nurse. We have a trauma nurse, usually work in the emergency room. This nurse provide care to patients in their situation when maybe there is an accident, any kind of an accident. They usually step in and do what and give help. Yeah. So we have which type of nurse? Let me check. We have toxicology nurse, a nurse who take care of patients who have swallowed poison or come in contact with toxic chemical. Yeah, that is their work. Toxicology nurse, they are called toxicology nurses. I don't know if they are in Kenya or where we have telephone triage nurses. They help patient over the phone by assisting their need and making sure they are referred to the right health care facility. They are not in Kenya. That is true. They are not in Kenya. We have telementary nurse, a nurse who monitor patient who are on life supporting or in life monitoring equipment such as electrocardiogram. They are called telementary nurse. So I think this one you have to do a general nurse so that you can go and specialize there first. Some of them are not in Kenya. You know, Kenya, we are lacking a lot of things. So some of these specialists are not in Kenya. So the next specialist, the next type of nurse is substance abuse nurse. This nurse, okay, a specialized version. They are a specialized version of psychiatric nursing, specifically deal with patient with substance abuse. Yeah, that's the nurses that most of the time deal with substance abuse. Maybe they counsel, they help the patient maybe in rehabilitation center. I think they are the nurses who are in the rehabilitation center to help those patients recover. The next type of nurse we have subacute nurse, a nurse who take care of patients who require around the o'clock care, The difference between this and a long-term care nurse is that subacute nurse patients usually only require the care for a short period of time. Yeah, they usually require the nurse patient who usually require nursing, or they usually require care in a short period of time. So we have school nurse who take care of the children in school. I don't know if in Kenya we have a school nurse. Maybe in high school we used to have school nurses. And even we were doubting if they were really professional, because the way they were behaving or the way they were giving treatment to the patient, to us, it was really alarming. I don't know if in Kenya they usually take someone who is really a professional nurse, because they should consider that. Yeah, they should consider that. They should not take just somebody who maybe have done something else and they put that person there and they mistreat or they mismanage patient. You find that you have a condition that maybe they're supposed to refer, because a school nurse, they don't have all the equipment in school so that they can manage that patient. So they need to diagnose and refer that patient or that school child. And you get that maybe the student will end up complicating, because this nurse cannot even identify. This nurse will always be, anyway, I was talking about specialists. So a school nurse, they take care of the children in school. Yeah, I think mostly in high school and in boarding school. In boarding school is where we usually have school nurses. The next type of nurses, we have rural nurses. I don't think if this one they're supposed to do general nurses, when you can be a rural nurse. These type of nurses, they work in rural geographical area. Often this area are going to have limited access to care. So I think rural nurse, maybe they always provide some simple treatment that are not, maybe like deworming, taking wound care, referring the patient. I think those are the type of care that they usually give. The next type of nurse is rheumatology nurse, a nurse who whose patient deal with rheumatic diseases, like for example arthritis and gout. These are the nurses who will take care of this kind of patient. Also we have a research nurse. Research nurses are available, a nurse who does clinical trial to figure out new evidence-based practice. Yeah, those are research nurses, and it is well paid in Kenya. You can go and do that. You can go and specialize there. Yeah. Also we have registered nurse. Most of the country we always have registered nurse. Registered licensed nurse is what need to be able to work and function as a registered nurse. Well, I mean, the registered nurse license is what is needed to be able to work and function as a registered nurse. You can get these licenses in several schools available around, and we have rehabilitation nurse. These are nurses who work in the rehabilitation center to take care of those who maybe have disability, long-term disability, or to prevent complication that may come in when you have a condition that can lead to a complication. So I think that is it. We have radiology nurse. Those are taking care of patients in the radiography center or radiologist. I mean, yeah, those nurses that take care of patients who are going for imaging. They take care of patients who are undergoing for radiation treatment. They are called radiology nurses. You can go and specialize there. And also we have, I said I'm going to confirm because there are so many, I cannot cram them all. There are 100 plus. We have pulmonary nurse, a nurse that take care of a patient with respiratory disorder or illness. Yeah, this one you have to do a general nurse is when you can get specialized. We have public health nurse, a nurse that provides education and care for patients and people within the community. Yeah, we have those type of nurses in Kenya. We have a psychiatric nurse, a well-paid nurse, and it is an advanced nursing practice, registered nurse who provides specialty care to a patient of psychiatric and behavioral health disorder related to psychiatric diseases. Yeah, those are psychiatric nurses. We have post-anesthetic care nurse, the nurses who take care or give close observation to a patient who is just from a surgery, and they give treatment to those patients who receive anesthesia. They observe complication and they are able to correct or identify so that they can be taken care of immediately. We have plastic surgery nurse, a nurse that take care of a patient who has undergone cosmetic or sometimes surgical procedure. For example, liposuction. They are not provided in Kenya. That is the problem. And we have those type of nurses, plastic surgery nurses. We have what? We have pediatric nurse, a nurse that is specialized and can take care of children by providing primary care health services, and they work hand in hand with pediatrician. Yeah, we have those type of nurses, and they are also available in Kenya. We have parish nurses, a nurse that take care of patients with a religion community. There's like those. We have some religions that they don't want to be taken care of. They don't want to be taken care of by just anybody. They just want their nurse, and this nurse we call parish nurse. They take care of them. And then we have palliative care nurse. These are nurses that take care of patients with terminal illness condition like cancer. So those are the nurses that you can go and specialize in palliative care nurse, or yeah. So they are those who have to take care of patient with what, with terminal ill conditions such as cancer. Pain management nurse, they're just nurses that deal with chronic pain sometimes, and maybe those nurses are the nurses that are those type of pain, they usually may be from patient with chronic illness. Yeah, we have what, so the next one we have ophthalmic nurse, a nurse that take care of patient with eye disorder. Yeah, like glaucoma. Yeah, those are the nurses. And then also we have operating nursing room, a nurse that work in operating room and assist the surgeon during the surgery. And the operating room nurse can work either before or during or after the surgery. Yeah, so sometimes we call it theater nurse. We have also oncology nurse. These are nurses that take care of patients who have cancer. Yeah, the nurses that take care of patients who have cancer. We have also occupational health nurse, a nurse whose job is to protect the safety and well-being of employees. They are called occupational health nurse. You can go and specialize there. Obstetric nurse, also called OB nurse, and these are type of nurses that to take care of female patients during labor, during pregnancy, and during childbirth and postpartum. Yeah, those are called obstetric nurse. They are able to diagnose and also treat some kind of obstetric condition. Yes. We also have Aspreneur or nurse plus entrepreneur. This is a nurse who is also an entrepreneur. It's a nurse that uses their training to start their own business, while it is more commonly referred to as a nurse who start a healthcare business. So those are, they call the nursepreneur. Yeah, that. Yeah, we have nurse practitioner, advanced practice nurse that provide primary care to a patient depending on the practice, on the state, depending on the, I mean, it is an advanced practice that provide primary care to a patient or to patient. Depending on the state, they can treat, diagnose, and prescribe medication. Yeah. We have nurse manager. These are the head of the nurses, and they work to manage everything around the hospital. We have nurse life care planner, a nurse life care planner, a nurse. They are nurses that create a long-term care plan for a patient that is going to need some form of medical care and attention for the rest of their life. They're called nurse life care planner. This type of nurse is not in Kenya. Maybe they are in the other countries. We have nurse executive, a nurse that hold a higher level management position in hospital. For example, they can be called chief nurse. Yeah, this one you can get even if you have done just a general nurse. You can become a chief nurse, or you can become a matron. We have nurse educator, a nurse that teach nurses, student. Yeah, those are the lecturers. Yeah. And also we have a nephrology nurse, a nurse that take care of patient with kidney problem. Yeah, we have neonatal intensive care nurse, a nurse that take care of premature baby and usually critical ill newborn in the newborn unit in the hospital. We have missionary nurse, a nurse that work for non-profit, religious or non-religious, providing care to patients who are mainly sometimes in advanced area or part of the world, And then we have military nurse, a nurse that work with in the military and care for patients or military patients. We have surgical nurse. A medical surgical nurse work with a variety of patients in medical surgical floor, from pre to post-operative surgery to minor to severe illness, and they give medical treatment, and also they are capable of preventing complications. We have legal nurse consultant, a nurse that work with lawyers as a medical expert in legal cases. As the medical expert, they help the lawyers understand the medical and healthcare related points. And also we have lactation nurse that work with new mom to help them breastfeed their newborn. We also have international nurses that travel and work with other part of the world, similar with travel nurse. Infusion nurse, that they are nurses that administer medication to patient via IV or intravenous line, and other access point. And then we have ICU nurse, the nurses that work in the ICU center to take care of those that having problem with their life. Hospice nurse, a nurse that provide care to patients with terminal ill. They require very compassionate care because the goal is to minimize pain and allow the patient to pass on with dignity. So these are nurses that take care of those patients with terminal illness. Again, we have home health nurse, a nurse take care of patients in their home-based care nurse. We have also holistic nurse, a nurse who focus on a nurse whose focus is on treating the whole patient. Also, they are called complementary health nurse. This nurse, on top of the traditional nursing approach, also takes a mind, body, and spirit approach. They are called holistic nurse. We have HIV nurse. This one, are the patient that they are nurses that diagnose. They are the nurses that counsel. They test, they counsel, they give treatment to HIV patient nurses. Hematology nurses, they take care, they administer blood and also take care of patient who is getting blood or who has diseases related to blood disorders such as hemophilia. They are called hematology nurse. We have which one? Gynecological nurse, a nurse that work hand in hand with obstetric nurse, and they take care of patients who are in labor, pregnancy. They take care of a woman in reproductive age, whether pregnant, whether is not pregnant, complication related to reproductive health. They are the nurses that take care of that. We have gerontology nurses. They are the nurses that take care of the old. They sometimes they need a lot of care, and these are the nurses that will take care of them. Those are in up countries, not here. We have geriatric nurse. Geriatric nurse focus on the elderly population. They're the same with gerontology nurses. They take care of the elderly. We have genetic nurse that work with patients with hereditary illness such as Alzheimer's diseases. Yeah, we also have forensic nurse, a nurse that works closely with the legal system to collect forensic evidence in a case where there has been a victim of violence. Yes, we heard they're called forensic nurse. Flight nurse, the same as travel nurse. We have fertility nurse, a nurse whose patients are either couples or individuals who are having a problem with reproductive health. I think they also work hand in hand with the obstetric nurse and the gynecological nurse. And then we have family nurse. That one you know very well. We have endoscopy nurse, and these are nurses that the term endoscopy nurse is referring to more in the GIT nurse, the gastrointestinal, the people who work during those procedures when maybe the patient is in need of imaging, or they should go for endoscopy. That the nurses that will take care of this patient, they will ensure the consent is signed, they will ensure the patient understand the procedure, they will take care, they will make sure that the patient during the procedure is comfortable. Yeah, they're called endoscopy nurse. We have endocrinology nurse, a nurse that take care of patients who have endocrine disorders, for example, diabetic and pituitary disorders. So we have emergency nurse or emergency room nurse, a nurse who work in emergency area to take care of patients who have emergency cases. Any kind of, there can be respiratory distress, they can be bleeding because of trauma, they can be maybe a choke. Yeah. We also have domestic violence nurse. I think that one you know how they will help the patient. We have we have cardiac care nurse, a nurse that take care of patients with heart diseases such as heart failure, coronary heart diseases. They also take care of patients who are recovering from heart surgery such as heart biopsy. Yeah, these are the type of nurses that in future we should have them in Kenya. Yes, some of them are not important. That is why we are passing those ones. So we have so many specialists, even I think I've not exhausted them, but you can, if you are a nurse, you have done a general nurse, you can go and specialize in one or two or three if you can. We have so many of these: anesthetic nurse, pediatric nurse, how do you call that, theater nurse, a midwife nurse. Even that one I've not said. A midwife nurse, that one will take care of labor, or maybe they have called it in another. Yeah, we have a midwife nurse, we have pediatrician nurse, we have so many type, urology, oncology. These nurses, they can help, or they are trained in that specific field, so they are more, they have more knowledge on that field. So you can go and specialize that if you don't want to become a general nurse. You don't want to be rotated from one place to another because you are a general nurse. You can go and specialize so that you focus on one field. So guys, thank you for watching this video. Let's meet in my next video. Okay, before I finish, I'm going to be giving a lot of content concerning nurses, health, and any other educative video, maybe according to the way you will request. In case you want me to talk about anything, you can comment in that comment section. It is always open, and let's meet in my next video. Bye.